So what causes erectile dysfunction in younger individual? Today I am going to discuss the factor that affects the sexual health in younger people. Erectile dysfunction is not as common in younger people compared to older individual, but it can still happen. There are certain factors that can cause erectile dysfunction or affect the sexual health of a younger individual. Here are the 7 potential causes for erectile dysfunction in younger individual. Number 1, psychological factor. Performing anxiety. Feeling pressure to perform sexually can lead to anxiety, which may contribute to erectile dysfunction. Stress and depression. Mental health conditions like stress, anxiety, depression, and relationship problem can affect sexual function. Body image issues. Concern about body image or self-esteem can impact sexual confidence and function. Number 2, lifestyle factor. Smoking. Tobacco use is a risk factor for erectile dysfunction and lot of other vascular problems in our body. Excessive alcohol or drug use. Heavy alcohol consumption or any illicit drug use can interfere with sexual function. Lack of physical activity. Sedentary lifestyle can contribute to poor blood flow, which leads to erectile dysfunction. Poor diet. Unhealthy eating habits can lead to obesity, which is one of the common factors for erectile dysfunction in younger and older individuals. Number 3, certain medical conditions. Certain medical conditions can affect erectile function or sexual function in younger individuals. Diabetes. Poorly controlled diabetes can damage nerves and blood vessels, leading to ED. Cardiovascular diseases. Heart condition that affects blood flow can also impact erectile function. Neurological condition. Conditions like multiple sclerosis or Parkinson's can affect nerve signal involved in erections. And sleep disorder. Conditions like sleep apnea can indirectly contribute to erectile dysfunction. Number 4, certain medication. Certain prescription medication can affect sexual health of a younger individual. Some medications such as antidepressant, antihypertensive medication, or medication for prostate condition. Number 5, substance abuse. Illicit drug use, especially substances like cocaine or methamphetamine, can contribute to ED in younger individuals. Number 6, relationship issues. Conflict, communication problem, or lack of intimacy in relationship can impact sexual function in younger individuals. And number 7, hormonal imbalance. Not very common in younger individuals, but it can still happen. Conditions such as low level of testosterone or thyroid can contribute to erectile dysfunction. It is very important for a younger individual experiencing erectile dysfunction or any type of sexual problem to contact their doctor and get the full evaluation done to find the underlying cause.